Hi everyone, Dr. Nemechek here. I want to talk about reflux and heartburn. Nobody really talks about what causes this, yet we have all these commercials online about Nexium and Pradlacek and blah, 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 blah about how to treat that, all right? It's primarily a neurological problem, all right? It's your stomach is not emptying correctly, and acid and materials with bile can build up, and so much so it can actually reflux where the valve to the esophagus doesn't work right, and it can spray back up, and it's a neurological problem. And we know this because we have, when people get concussions, so you get a hit to the head, you snap some neurons in your brain, it doesn't bleed. And there's all sorts of surveys talking about what kind of symptoms do you feel in your head, okay? Well, if you look around, you can find these surveys that say, what happens from the neck down? Because your brain controls everything. And what you find is about 30 to 50% of people, after they have a concussion, have reflux or heartburn in the first week after a hit to the head, okay? And basically, these brain traumas, they cause if you think of your intestinal tract like a conveyor belt, the whole thing slows down. And what you also see in these surveys is some abdominal cramping, or you might call that irritable bowel syndrome. And about 50 to 70% of people have constipation after getting hit in the head in the first week. Now, most people are going to recover out of that, but the problem we're in is so many people have chronic inflammation from a variety of sources. And me, I primarily look at what's coming from the gut bacteria, from the food supply in terms of these inflammatory omega-6 oils like soy oil, safflower oil, corn oil. And then along the line, then the vagus nerve can fail from these effects. And the vagus nerve is your master controller for inflammation. So all this stuff kind of builds up. But if you have chronic inflammation, you get an injury, you don't fully recover. And so you could be left with that after an injury. And the injuries aren't just like getting knocked unconscious. So some of these injuries can be what we call subconcussive events, meaning less than a concussion. So we know that the equivalent of hitting a soccer ball will snap neurons in your brain. That might just be a rap on the head when you hit your head against the hatch of the car. You feel more stupid than anything. You don't think you need to report it to a doctor or anything, but you just got a little damage. And if you have some chronic inflammation, you just left a little damage behind. It won't fully recover. And then emotional traumas can give you these injuries. And then inflammatory trauma can give you these injuries. So examples of inflammatory trauma are like surgery, fractures of big bones like your hip or your humerus. And then things like COVID can do it. And COVID does it a lot. Now, if you don't have chronic inflammation in the body, you're going to repair all of this stuff within a few weeks to a few months. But if you do have chronic inflammation, it starts building up, and now you're kind of stuck with it. Now, another major source of reflux and heartburn is still neurological, but it's being driven by bacterial overgrowth, an imbalance of intestinal bacteria, and they communicate through the nervous system in a irregular manner and can slow the intestinal tract down as well. So both are neurological, and both have a solution. If it's a pure gut, bacterial overgrowth, we use Xifaxan or rifaximin for that, and that you can that'll clear that very quickly. If it doesn't, then you're looking at a more central or brain-driven neurological abnormality, and that takes our kind of fuller protocol to kind of help you get that squared away and make that go away. So I hope you find that helpful. Otherwise, you all take care now. Bye.